you doing?
Okay, how can we help you?
Well, I am calling on behalf of my grandma, who is 83 years old, and she is unable to move any of her limbs, really. She is just laying there. She could move her facial muscles, but she can smile, she can move her eyes, but she cannot move anything else.
Okay, now, did she get diagnosed with a disease? Does she have a stroke? Does she have an aneurysm? Does she have cerebral palsy? I mean, what has she got?
Well, the doctor said it could be a stroke. She had a stroke before, many years ago, about 20-plus years ago.
Okay, now, did these symptoms show up like overnight, or was it a gradual?
I would say it was probably gradual. I wasn't around her at the time, but I heard she fell. She fell one day while walking, and I don't know if that triggered it.
Okay. And how much does she weigh?
She weighs about 150 thereabout.
Okay, 150 pounds, okay. All right, does she have any other issues, any high blood pressure, diabetes, arthritis?
She has hypertension, high blood pressure.
Okay. Does she have any history of skin problems, eczema, dermatitis, psoriasis, or respiratory problems, COPD, asthma, anything?
No.
Okay. All right, Charmaine, you there?
I'm here.
Okay, here's a 83-year-old grandmother, 150 pounds. She does have a little bit of high blood pressure. She has a history of stroke, and she's having difficulties in moving her limbs. Can she speak, Darian?
No, she cannot.
Okay. Can she blink her eyes once for yes and two for no kind of thing?
She can blink her eyes, but she cannot speak.
Okay, but she can understand what you're saying, and so she can respond with a yes or no or with her eyes.
Yes, pretty much.
Okay, good. Okay, good. Okay, so Charmaine, she weighs 150 pounds, has high blood pressure, has had a previous stroke, and she did fall, and after her fall, this sort of thing came on her. She can't move any of her limbs, and she cannot speak. So what would you do for her to support all her systems at 83 years of age?
Well, for those issues, I would suggest that she probably takes 2 healthy brain and heart packs and adds the Ultimate Daily Classic to that, and also some glucogel and MSM and vitamin D3.
Okay. That's a good start. Yeah, let's start there. And so I'll go over that again for you, Darian. Okay, you want to get her 2 healthy brain and heart packs per month, 2 healthy brain and heart packs per month, a full dose of everything twice a day. The glucogel capsules, you want to get 2 large bottles of glucogel capsules so she could have 15 a day, 5 at breakfast, 5 at lunch, 5 at dinner. You can open up the capsules and put them in a shake. We have a wonderful shake called Slender FX. If you make it with water, she'll lose weight. We don't want her to do that. You can make it with a heavy whipping cream, and that way she may even gain a little bit of weight and sustain her weight, but also that heavy whipping cream is good for the brain and spinal cord. Okay? And I also want you to give her, Char said, the MSM. You can grind those tablets up and put them in that shake. 1 bottle a month. We'll give her 3 of those MSM tablets twice a day. Vitamin D3, 3 capsules twice a day. That's 2 bottles a month. Or if there's a caregiver there who will spray her mouth 3 spritzes in the morning and 3 spritzes in the evening, we also have what we call the citrus vitamin D3 spray. Okay, so you have the choice of the spray or the capsules. And then the Ultimate Daily Classic tablets. It's going to support healthy blood pressure as well as healthy blood flow through blocked arteries. What would you give Charmaine? Because she has a history of blood clots, she may still have some residual blood clots in her upper spinal cord and brain. What would you suggest for her that has the capacity to dissolve blood clots?
I would have her take some Niacin Plus.
Okay, the Ultimate Niacin Plus, you're quite correct. I'd have her go ahead and be a little heavy-handed here. Go ahead and take 1 3 times a day, 1 at breakfast, 1 at lunch, 1 at dinner, or if that's too clumsy, take 2 twice a day, and then grind them up and put them in her shake. It's the Ultimate Niacin Plus, 2 bottles a month. And call us every 2 weeks. Call us any time, Darian, but don't wait longer than 2 weeks to give us a progress or lack of progress report.